Our session 11 is synthetic turf and potential human health impacts. It's my pleasure to introduce another one of my coworkers, Emily Wang. She's a senior environmental scientist. She works on issues related to used oil and household hazardous waste. She has worked at CalRecycle for 14 years, where she has served as a technical advisor for California's used oil collection program, helped to write regulations for the paint product stewardship program, and compiled data and collection statistics statewide through the Form 303 and the annual reports. Emily attended the California University of Technology in biology and obtained her Bachelor of Science degree in biology. Please welcome Emily Wang.
This is you?
No, I don't have a presentation.
No? Oh, okay.
Hi, thanks for having us. So we'll have two different speakers today to talk about synthetic turf and human health concerns. I just wanted to start off giving a little bit of background and context for it, and then I'll introduce our two speakers here. So the big scrutiny happened, as mentioned earlier, around 2009. Concerns started arising about synthetic turf fields and possible cancer rates in soccer players. So in 2015, CalRecycle contracted with the Office of Environmental Health Hazard Assessment, or OEHHA, to conduct a human health assessment on synthetic turf fields containing crumb rubber. This has been a really big multi-year project, and that there's been plenty of opportunity for public comment, and there's also been a scientific advisory panel to help design and advise on the study to make sure that the topic was approached in a comprehensive manner. In the meantime, while this study is happening, some other agencies have conducted their own studies. For example, the European Chemical Agency and the Netherlands National Institute of Public Health and Environment in the Netherlands, and the Washington State Department all conducted various studies. Some of them were field investigations, risk assessment, and some of it was cancer cluster investigation. None of those studies thus far have shown, have directly linked synthetic turfs to significant increases in cancer or other human health risks. So one of the key elements of the OEHHA study is that the other ones didn't have, is that it includes a large non-targeted chemical analysis that basically attempted to identify as many chemicals as they could from the samples. Previous studies had really only relied on existing chemical lists that they knew about, but tire manufacturers know what goes into the tires, but then the process of vulcanization changes the chemical. So it's not like the tire manufacturers necessarily know exactly what's in the final product, because the process of making the tire changes the chemical makeup. So basically, OEHHA also contracted with a group at Berkeley to do behavioral surveys to help develop exposure scenarios to properly understand the level of exposure that soccer players or other participants might experience on these fields. And what he has done is try to take this list of non-targeted chemicals, done sort of some assessment, and we'll be combining it with the exposure scenarios to finally come up with a risk assessment. This is, I mostly bring this up to note that this is not, the primary focus of the study has been human health and cancer concerns. A lot of this study design was instituted and created with the cancer concerns at the top of the mind. And at the time, we didn't know about the 6-ppd issue. Zinc was not as critical of an issue as it is become. So the focus of the study has not been on environmental impacts like leachate or runoff, things like that from the tires. It's much more about just what's in the crumb rubber turf fields and what exposure we have. So with that, I'm going to introduce our two speakers. First, we have Dr. Vincent Cogliano, who's the Deputy Director for Scientific Programs at OEHHA. That office protects and enhances the health of Californians and the state environment through scientific evaluations that inform, support, and guide regulatory and other actions. He previously worked at the U.S. EPA and directed its Integrated Risk Information System program, and he was the deputy to the agency's scientific integrity official. He was also the head of the IARC Monographs program at the International Agency for Research on Cancer. There are a series of scientific reviews that identify environmental factors that include the risk of that may increase the risk of cancer. He received his PhD from Cornell University, and he's professionally very interested in qualitative and quantitative health risk assessment and its application to the protection of human health. And I'm just going to jump into the introduction for Stratton first real quick, and then we'll get to everybody. And our second speaker will be Stratton Curtin, who is speaking to us from the industry perspective, and sort of how industry has dealt with the concerns about the synthetic turf fields. He's a managing director at Penta, I believe, is that it?
We went through a rebrand. Now we're Penta.
And he's responsible for advising clients on strategic communications with a focus on issues related to energy, environment, technology, and trade. His work has included launching a $1 billion clean energy venture capital fund, reauthorizing a major government-filed financial institution, releasing economy-wide climate action plans, announcing multi-billion-dollar coal retirement programs, and broadcasting a client's vision beyond our solar system. All right, now, Dr. Cogliano.
Thank you very much, Emily. Thank you to the organizers and to CalRecycle for sponsoring this human health study, and for all of you for staying to the end of the session to listen to the presentation. Our office is the California Office of Environmental Health Hazard Assessment. We're part of the California EPA. We do a lot of things in addition to the tire study. We do the air toxics hotspots assessments. We do public health goals for drinking water. We manage the implementation of Proposition 65. We issue fish advisories. We do special assessments like this. A similar one that we finished last year was on artificial dyes in foods that children eat. We also put out CalEnviroscreen, a human right to water. Just earlier this week, we did the report on the indicators of climate change in California. I advise you to go to our website. There's a lot of very interesting information there. And we also work on the biomonitoring of California program. So how does this study differ from the others? We're fortunate in that we are coming after other studies were done, so we can learn from them. And what we've tried to do here is to have a really comprehensive and definitive study of all the different aspects. So Emily mentioned about the non-targeted analysis of chemicals. So we're not looking only at the chemicals that are initially in tires, but how they might have already been changed in the environment. So we look at the chemicals that are actually coming off the fields. We're also going to talk about exposure characterization. We did a lot of looking at the different types of people that are on the field, the players, the coaches, referees, spectators, and they each have a different set of exposures, and we're looking at those. And we're going to put that information together, the chemicals that we find in the air and on the field, with the people that are on the fields, and do the human health risk assessment. I'm going to talk about how we're looking at chemicals, how we're looking at the people's exposures. We have not put together those to get any kind of indications of human health risks at this time, and I won't be talking about that today. So the field characterization of chemicals. We're basically looking at what is in the air, what is on the field, how much are people exposed to. So we put air samplers on different fields, in different locations of the fields. We also looked at the chemical, had samplers on the field, and we had a sampler off the field as well. So if you can think about if there's a field that's maybe a quarter of a mile away from a highway, You might see diesel exhaust particulates on the field, but you're also going to see them off the field as well. And so this is a way for us to determine which chemicals are really coming from the field and which are just present because they're in the general neighborhood. We also have the photo you see on the right, samplers at different heights. So you might think that the particulates are going to maybe be kicked up during a soccer game, and they're going to stay within the lower 1 foot of air, but they're not, much less is going to go higher up. So we have samplers at different heights to try to get a feel for how much of each chemical or each particle is at different heights and which ones would be in the breathing zone of people. How to identify the chemicals? So there's something very technical called gas chromatography, mass spectrometry, but basically you get a sample of air and you will see some kind of, in the upper middle, you'll get a bunch of peaks at different frequencies. And each one of those corresponds to a chemical. So we can go sample air and find out what are the chemicals that we're finding in the air. You can consult references to find out exactly each of those peaks corresponds to a particular chemical. The height of the peak corresponds to the concentration of the chemical. And so we had about 200 chemicals that we found in all of our air sampling. Many of them were found both on field and off field. So it gives us a way of figuring out what is really coming from the field and what the concentrations might be. Non-targeted just means we're not starting with a fixed set of chemicals that we know are in tires at the beginning when they're manufactured, but we're looking at how they're weathering, how high temperatures, how years might change those chemicals, and whatever is there on the field that the kids are playing on, we're able to sample those. A similar process is done for water-soluble chemicals. Water-soluble is important, for example, in what gets on sweat. When kids go down on the field, they're all sweaty. Some chemicals are going to be absorbed into that sweat. So basically, we looked at all of the different chemicals that you get either from the air or that are water-soluble. And we looked at the peaks again in those mass spectrometry readings and identified those with chemicals, identified with the concentrations of the chemicals. And so we have all of that. Now, we looked at 35 fields across California. The different colors here are different climate regions. So you have the wetter coastal zones, North and Southern California. You have the northern forests, which are wetter. You have the Central Valley, and you have the desert area. So we have different types of climate conditions, and we're putting that into our analysis so we can see how climate conditions might affect, not climate change, but just the weather conditions basically can affect what's coming off of those. 35 fields, they covered all climate regions of California. The newest field was about a half a year old. The oldest field that we sampled was about 14 years old. So we also can do some analyses to try to see how levels might decline over time in trying to figure out what the health risks might be. So there were a lot of different chemicals. Ultimately, we looked at tire-related volatile organic compounds, semi-volatile organic compounds, carbonyls, other common air pollutants, and over 100 chemicals. We looked at the ones detected on the field and off the field as well. Again, most chemicals that we detected on the field were detected off the field as well. So that means a lot is coming from just the general neighborhood air, depending on where it is in the state. These are statewide aggregates. Individual fields might have a lot smaller number of chemicals depending on where they're located. We also look at the concentrations of the chemicals on the field and off the field to see whether the field is a significant source of exposure to each of these chemicals. Some chemicals were detected only on a few fields. So again, we're looking at on the field and off the field to see if those chemicals that were detected on only a couple of fields, is that because it's a new field and the chemical hasn't had a chance to off-gas and dissipate, or is it because it's located in a particular neighborhood that has a particular industrial or pesticide type of exposure that is giving that chemical in the general neighborhood. So we're trying to really assess what's coming off the field versus what's in the general neighborhood and is not due to the field. I'll put one of the things that we didn't detect, we have not detected PFAS chemicals. That's something that's of national importance, also of importance in California. We're not detecting them as related to these fields. So one of the other things we do, so we detect chemicals. The other thing is, are they important for people's exposure? So if they're in the air, yes, people are going to inhale those. But if they're on the ground in the crumb rubber, they're only important if people are exposed to them. So we also made mixtures of artificial sweat and artificial gastric fluids so that we can tell if somebody is like dives down for the ball and they get dirt all over them. Is this dirt actually going to be absorbed into the sweat that's on their hands and be of concern? Or if they're diving onto the field and they swallow a bit of dirt and that gets into their digestive system, is that going to be absorbed inside the body or not? So we subjected all the chemicals that we're finding to suspended them in artificial sweat or artificial gastric fluids to see whether there's a potential for them to be absorbed into these fluids. And so there's actually differences between sweat and gastric fluids. So we're finding different chemicals in each of these. They're chemicals with big, long names. I can't tell you anything really off the top of my head about the health hazards, but we have looked at all the health agencies that have assessed any of these chemicals to determine what are the health effects, what are the exposure levels at which these effects are of concern. And we also looked at various metals. I've been hearing about different metals that are going to be present. So we have those as well. We're looking for them in the crumb rubber and the range of them. And so, for example, zinc, you see at the very bottom, is one of the ones we have a higher exposure to based on what's in the crumb rubber. Aluminum is another one, but there's other metals at much lower concentrations. So the second, I'm going to talk about the exposure characterization, and this is another area where we're trying to be really in-depth and comprehensive. So one of the questions we ask, who are exposed? So of the people that visit these soccer fields or play on these soccer fields, we have four different major categories of people. There's the children, there's the athletes, the soccer players, and we have what kinds of things they do, how long they're on the field, and so on. There's also coaches and referees who might be on the field, but they're not doing things like diving for the ball as often as the athletes might be doing. And there's spectators who might be sitting on the field, or they might be in stands near the field. There might be kids who then do wander off and go play on the edges of the field. So we have different categories of activities that people perform on these fields. So the four main groups, though, are the athletes, coaches, referees, and spectators. And so we did a pathway analysis for each one of them. So the first one is the air. And you're going to go from the left. On the bottom, there's a bit of a flow chart. You have the synthetic turf, and you could either have gas that's volatilizing off of that field, or you could have suspended particles. As people are running around, they're kicking up dust, and those particles are also in the air for a period of time. So people can breathe them, and we've said that everybody who is on the field could be exposed in these manners: athletes, coaches, and bystanders or spectators. Different amounts. Athletes who are running around are going to have a higher inhalation rate than a spectator, so we have that figured in, but everybody is exposed through the air. Next, direct dermal contact. This means actually touching putting your hands, or if you're on soccer with shorts and a short sleeve shirt, your arms and legs can also be exposed. We figure that the athlete can be exposed. Coaches and referees are generally not going to be on the ground, so we're not considering that as a a significant exposure pathway, but by standards could be sitting on the field, they could not be. So we have basically some assumptions we make for how many are going to be actually directly exposed to the field or not. Then there's indirect exposure. Now this means you're touching objects. So for example, the ball. The ball is on the field a lot. At some point you have to take it and throw it back into the field, or the goalkeeper is catching it. So that's indirect exposure to the compounds that are on the field. Again, we look at the ones which are going to be soluble in sweat and so on. But spectators also can have some exposure because they can be putting a water bottle down on the field and then drinking it, so they could be touching it as well. Again, a different amount of exposure than the athletes. We thought, though, that from the air, the indirect is going to be lower, not a significant route. Then the gastric fluids, that's basically if you're getting dirt on your hands or you're diving for the ball and you get some dirt in your mouth. So we have some estimates of that. We had, before I get to that, again, we had contract with the University of California and also with the University of Arizona. They took, with permission, videotapes of several soccer games and followed specific players. And so we have figures for how often did a goalkeeper dive to get the ball or catch the ball. How often did other players fall down on the field and have their hands in contact with the field? How often did people come in contact with the ball to throw it back in? So we have these kinds of figures because then people looked at the videotapes and counted up the incidence of where somebody might be in contact with these chemicals. So we did that as well. And so we're going to put those all together, the exposure estimates for the different categories of people that are on the field, the amounts of exposure they're going to have, the different chemicals that are on the field, the toxicity of those chemicals, and we hope to have a draft assessment in early 2003. We have a scientific advisory panel which will be able to look at this and review, make some comments, and before we issue this as a final report, hopefully sometime next year. So with that, I want to thank you. I'll turn it back to you. Okay.
Got my flashlight on. All right. Thank you, everyone. I appreciate you staying until the end for me. Or the worst. So, my name's Curtin. As was mentioned, I'm with Penta, but why I am here is because I work with the Recycle Rubber Coalition. What is the Recycle Rubber Coalition? Hopefully the name explains it to you, but it's a group of companies who manufacture crumb rubber, who also are end users, and some turf companies. Historically, we've mostly focused on the recycled rubber side of things, but as you can imagine, and as all you know very well, to many people, the distinction between synthetic turf and recycled rubber, there's no difference. So we end up talking about a lot of the issues. So I'm here specifically today to talk about sort of the view from policymakers across the country, not specific to California, and what we've heard, and what are the macro trends, and what are they raising to us as their concerns. And so I think what will be interesting following this conversation is while under the broad banner of sustainability, conversations about health come up, is not actually the primary concern we hear from policymakers anymore. As Emily mentioned, as was mentioned, I think, by one of our questioners in a previous panel, because there are not a few studies, not 10 studies, but well over 100 studies looking at different aspects of this. So there's always different ways you can go deeper and look closer at the data and human health concerns. But broadly speaking, outside of a very narrow group of like advocacy organizations, who just don't like turf fields, if I'm being pretty candid, there's pretty broad acceptance that most people think the science shows that synthetic turf and recycled rubber infill are generally safe. All right, so I don't want to go through basics with this audience because everybody knows the basics, but let me tell you why I think they're important from my perspective. Policymakers do not know the basics. Policymakers think about recycling the way that most people think about recycling. They think about curbside recycling. And if it's not curbside, they're generally not familiar with it, particularly if we're talking about anybody outside of tire programs. So thinking about the scale of the problem we face just in this country, setting aside around the world, with how many tires come off the road and having to do with something with them, is really a big level set with most policymakers. And added to that, they don't know how generally successful we have been. This is sort of one of those situations where they take a little bit for granted about how, because they're not thinking about tire stockpiles, they're not thinking about 1 billion tires. You know, they're hearing of cleanups where maybe there's 1,000 disposed tires, but nobody's talking about tens of millions in states, with the exception of maybe Colorado and Texas, as John pointed out yesterday. So one of the things is sort of re-anchoring them about where we are, you know, as a program, and like, yes, we can do better. Yes, we want to do better. Yes, we want to recycle more and move more from secondary uses to true recycling, but anchoring them in the scale of the challenge and where we are versus other materials that are being recycled. Now, on the turf side, I don't think it's a surprise that there's more work to be done. Turf is very good at the secondary use, really pretty nascent right now at what people would call the true recycling, but that is happening. There's technology that's proven, and those investments are being made in the US right now as that migrates from Europe over to here. So one thing that's come up a little bit and that I wanted to talk about is sort of alternative infills. So when health concerns came up, you know, there was sort of a jumping to like, well, let's just set all this aside. Let's not do the hard work of explaining trade-offs and why we need to recycle and the safety of it. Let's just go to a new product. Now, my view and our view of the coalition is every community, every school, every park, they should pick whatever works best for them, whether it's grass fields, synthetic turf fields, recycled rubber infill, alternative infills. But let me tell you why this isn't a quick fix. One, it has gotten bigger in the market, but recycled rubber still makes up about 85% of the market. But let's run through the three, and then I'll get to my original point. So there's lots of different types. I think of them in sort of three categories. Natural infills, as you heard mentioned, this is a very popular one, combination of cork and coconut. Virgin polymer infills, where this is rubber still, but it's either recycled rubber, coated in virgin rubber, or virgin rubber. And then specialty infills. This is one of my favorite. This is Nike Grind. If you don't know, they recovered the rubber soles from shoes and turned it into infill for fields. So really sort of a circular on the field economy. And I would also put other ones. There are ones that specialize in like antimicrobial properties and things like that, that also sort of fall in that specialization category. Now, let me read you a statement though about alternative infills, back to my point on they're not an easy fix. Choosing plant-based infills means using an expensive and controversial product that requires the use of carcinogens and many chemicals in addition to being a respiratory risk. It means a headlong rush into other dangers with multiple and unknown angles. I do not necessarily agree with that, but that's the criticism of it. One of the advantages that recycled rubber has from going through this very long and tortured debate is we're unknown. You can talk about the chemical compounds, you can talk about bioaccessibility, but we're unknown. And the people who have concerns, who raised these concerns originally about recycled rubber, are now raising the new concerns with alternative infills. So what are the sort of macro drivers we are hearing from policymakers? As I mentioned at the beginning, what you will notice is what's not on there is health and human safety. What is driving all of these, what is the macro unifier of all of these, is questions about sustainability and the broad definition of it. Questions about microplastics, questions about recycling rates, and questions about do we regulate or ban products, or do we actually try to solve the problem? Now, I'm going to talk about each of those in the context of what we've actually heard from policymakers at states and around the globe. So on microplastics, this is still an emerging issue, and if you're like me, maybe a couple years ago, you thought of this primarily as consumer waste, garbage going into oceans, straws with turtles. As was mentioned by one of our friends, I think from DTSC earlier, people are taking a much deeper look on microplastics. And what we've seen in the EU is they're looking at fields, they're looking at infill, and there's still a possibility they don't go down this road, but more likely than not, they're going to ban recycled rubber infill and lots of other infills with a phase-out period of 7 years. Now, here's where, regardless of where you sit, why that's a challenge and what we can learn from it. It's a challenge because, and this is me reflecting what folks from Europe have told me in the industry, it's a challenge because people in the industry didn't engage in the process with the European Commission, because when they looked at the list of contributors to microplastics, they felt like we're 99th out of 100 if we're on the list at all. They're much bigger fish to fry. We don't really contribute that much in terms of microplastics, in terms of infill migrating off the roads, so we know they're not going to target us. Turns out they're targeting them. And part of that is the industry didn't engage, they didn't tell their story, they didn't share their own data, and the European Commission went out and got their own data. And now the industry disagrees with it, but that narrative has already left. And so that data they came back with how much infill migrates off a field into the environment is now become the default standard for what they're talking about, even though the industry believes it's orders of magnitude greater than what the actual number is. Now, what's even more challenging is that there are proven off-the-shelf technologies to address microplastics in infill migration. Now, even if you think the number they contribute is small, but it should be smaller, it's gates, it's transition zones, it's best practices for when you're shoveling snow and clearing snow. And now they're starting to do, the industry has done real-world studies in Denmark and Sweden, and what they found is doing a test with a series of 3 fields, estimating 800 players a year, is that with these sort of known technologies, not things that need to be developed, things that can be installed now, is they can decrease that migration from players by 75%. So for a field that 3 fields that 800 people use, the total number of migration that they caught at the end of that was 6 kilograms or about 23 pounds, so less than the weight of 1 tire for one series of fields for 800 players. So the good news is those same sort of installations are happening now in the US, but part of the lesson here that I'll get to is we have to make sure that it's like if policymakers see a problem, that we have to engage, we have to tell our story, and we have to show proven technologies unless we want them to come up with regulations on their own, which we might not be able to meet. So next, thinking about recycling rates. As John pointed out, number of tires are going up, but recycling rates are staying flat. So how is that playing out in the policymaker environment? We've been in a couple of years where because of COVID money from the federal government, state and local policymakers are good. They're fat, they got lots of money. However, they are staring down the barrel of that money running dry and possibly a recession. Added to that, now in many states and requirements now from the federal government through the infrastructure law, they don't just have to get that money out the door, they have to start thinking about impacts and emissions reductions too. So they're facing an environment where they're going to have less money and asked to do more and better with it. That's actually making them revisit sort of their internal processes and motivations for things we've heard about a lot, like RMA, like rubber modified cement, because in many states, and I think California is definitely an exception to this, the motivation, especially when it's federal dollars, is get that money out the door as fast as possible for the lowest possible bid. And now they're starting to take a step back and think about that again. What is the life cycle cost of that project? And what are the life cycle emissions associated with that project? And that's making them take a second look at things like RMA. And then finally, regulator ban. One of the things that I think is an opportunity from this focus on sustainability is the fact that in many states, whether they knew it or not, when they decided they didn't like a product or didn't want it going to landfills in their state, all they were doing was exporting their problem to somewhere else. We saw that nationwide, worldwide, with what was happening with US recycling going overseas, and we saw it in states now, or states as well. What I've seen now, though, is policymakers realizing that we don't want to bury our problems, but exporting them doesn't really count as sustainability either. So what does that leave us with? That means we actually have to focus on figuring out what the problem is and solving it, which means secondary use and supporting recycling. And I'll give you one example of how that sort of trade-off is being played out is in Maryland, a state that has been extremely contentious for 5 years now. A policymaker who 5 years ago wanted to designate recycled rubber as hazardous waste and put a ban in place for synthetic turf fields has now come, now caveat here, we don't yet agree on the details, but is now talking about, instead of bans, instead of hazardous waste, how do we talk about EPR? How do we talk about chain of custody? How do we talk about transparency? And that's progress, even if we don't agree on the details yet. The last thing I'll talk about is how some of the macro nationwide trends in information and politics are also impacting this debate. And these aren't things we can change. These are things we have to adjust to when we're advocating on behalf of the industry or on behalf of our cause. One is advocacy. Anybody can be an advocate now, particularly in the age of Zoom, when testimony to state legislatures no longer means driving to Sacramento or driving to Annapolis or driving to Richmond. Anybody can not only be an advocate on social media, but directly with lawmakers. 2, news and information. We all know that more people are getting information from sources where they already agree. What that means for us is we need to think about when we're going in to meet with policymakers, sometimes what we think is well-known, widely accepted, basic information is completely unknown to them because that's not where they get their information. Partisan state governments. As you can see on this map here, more and more state governments, particularly at the legislative level, are single-party dominated. And so that takes out some of that normal friction that would be in the process that would force people to come together, to compromise, to maybe moderate positions. And it means that when policies and legislation move, they can move quickly, and often they're very, very sloppy. When I was flying out here, I went through Minneapolis airport and I saw a story on the TV that said Minneapolis accidentally legalized edibles, and which you can debate whether that's good or bad, but it said most people in the state legislature didn't actually understand what they were voting for. And then the last one is the scale of the challenge. For many states, they're being asked to think about much bigger and global issues with the same amount of resources, and particularly at state legislatures. If you think about states like Florida, part-time legislature, 2.5 months a year. Maryland, part-time legislature, 3 months a year. Texas, part-time legislature, 3 months a year, every other year. And they're being asked to tackle problems like climate change and handle tens of billions, of hundreds of billions of dollars for things like COVID. So these are just some of the things we have to adjust to as we're working our way through this. So I have some recommended reading here, organizations we work with, but what I'd like to close is I always sort of vacillate between thinking like, are things really bad or really good? I decided to choose optimism today because even though the environment is changing and that's difficult and it means we have to do things difficult, I think there's a lot of opportunity with this big focus on sustainability for us to communicate our position and to really make policymakers think about trade-offs whenever they are deciding where we're going, what we're doing with turf fields, what we're doing with recycled rubber, what we're doing with infill more broadly. So with that, I'll pause. I have my contact information at the end and look forward to taking questions.
Thank you. Do we have any questions?
Hi, I'm Nate Goff. I'm with CalRecycle. And full disclosure, I actually went to University of Washington, where all the turf infill hysteria started, or it expanded greatly. But I was there before they built the soccer field. My question is about that basically anecdotal issue with the soccer fields and the cancers.
Coach Amy.
Has anybody followed up with that specific coach with the University of Washington because it seemed to be, in a sense, isolated to that soccer field? Has anybody followed up and seen, has the same rates of cancers continued since that original report?
Can anybody hear me? Yeah. The state of Washington did an investigation specifically into the claims by Coach Amy, and I don't mean to use inflammatory terms, but sort of debunked them and said that not only were her accusations of higher rates of cancer not accurate, but actually her players experienced lower rates of cancer than you would see in people of the same age, likely because they're healthy, active soccer players. So the state of Washington Health Department did an investigation, I think within a couple years of those claims, but then we've also seen other investigations, including looking at sort of metadata in like the Journal of Cancer Epidemiology, looking at California, looking at the same information and seeing, is there a correlation between number of synthetic turf fields in a county and rates of cancer in that population? Also finding no evidence of that.
Okay, do we have any more questions?
I'm Noelle Davis. I'm a grant manager with CalRecycle, and I manage the tire-derived product grants and the tire incentive program. As I said earlier, we have a moratorium on utilizing Crumb rubber in synthetic fields projects that were formerly done under the tire-derived product grant program. I remember when the case came about the incidents of the University of Washington, Coach Amy, claiming that Crumb rubber was the source of lymphoma that was coming down in the goalies. You've just debunked that from what you said, but my question is more so towards the doctor with OEHHA, because since you have done all these studies, all these different tests at different times, different fields, 35 fields, has there any inclination to come to some sort of decision as to where this is leading? I saw on the slide that you anticipate having a draft in early 2023. Is there any inclination that you can give us so that we can take away what we've heard from other tests in Europe, in the United States, and everywhere else, that basically seems to lead to the fact that there's really no defining detriment to the health and safety concerns to the human population?
Well, thank you for the question. That's really what we're trying to investigate, and it's the reason why we're doing such a comprehensive study about really seeing what do the players do on the fields, what are the chemicals, are the same chemicals on field and off field. We really want this to be as much of a definitive study as we can make it.
Okay.
Beyond, we don't have our results yet, and beyond that, I can't really speculate what would be the next steps.
He's leaving us on the seat of our pants till, early 2023. We have a question online. Ed?
Okay, I believe this is for Dr. Cogliano also. It's from Armin Etamad with DTSC Safer Consumer Products Program. Were ambient conditions such as temperature, humidity, and UV index recorded as variables that were considered in the synthetic turf study?
I can't speak to UV index, but temperature and humidity is definitely part of it, and it's the reason why we're taking fields from all across the state to make sure that we can factor that into our analyses.
Steve Krause with CRM. When you guys present your findings next year, do you plan to also, when you present your results, give some comparable results as far as other types of interactions in just everyday interactions, so that people can kind of get a grasp of how comparable it is to levels of harmful effect if it's material, immaterial, and so that people can kind of get a relationship with their everyday activities?
You mean everyday activities that are not related to playing soccer on fields? Okay. We weren't really thinking about that, like having a whole comprehensive analysis of all the different risks, but we will be giving what the risks might be, and I think if there are any, I mean, I'm not saying that we've gone that far, but I think you'll be able to tell from the numbers whether it's something that's comparable to other risks or what kind of activities it would be comparable to.
Okay, we'll take our last question.
I had a question. Did you guys look at football players in addition to soccer?
No, they were soccer players.
Okay, let's give a round of applause for our panelists.
Hello, everybody. I hope you can hear me. I'm Kyle Pogue, Environmental Program Manager with CalRecycle. I'm part of Sally's team. She's part of mine. I just wanted to make a couple of observations and announcements. One is, I know Sally's going to say some thank yous, but I really appreciate the discussion today. Appreciate everybody being a part of that discussion, and know that CalRecycle is here and listening to your comments, your input, and I think it's been a fantastic event. And it's a big testament to everybody that's here or online participating in this. So I really want to thank you for that. Second thing I wanted to acknowledge is a few people that really stood out to me, as I want to thank the interpreters. The amount of work that you put into this, and you don't get a rest, it's really impressive. So thank you for that. Our caterer and the food service. I know you're going to do some of this, Sally, but it just really stands out to me how hard they work to put on a really good event. So I want to thank you guys for that too. Also, I want to point something out to you. Some of my colleagues in this room are on the cusp of retirement. They're part of my team. And I just want to step up and thank them for their effort. And I'm specifically talking about Stacy Patnoud, Albert Johnson, also Nate Goff. And Nate did a great presentation about kind of the history of the tire program. And to me, those three should be on pictures on those slides, because, you know, over the past, and I don't know what the collective years of experience is, but it's got to be close to 75 years. 100 years. Moose says 100 years. It's a lot, right? And they are the history of this tire program in conjunction with all of you. And they're all on the cusp of moving into retirement. And I want to thank them. I want to thank them for their public service. And I really appreciate you guys. So, and then the last thing, and I know you guys want to get on your way, but one other thing. Can you come up with me, Moose? I'll try and maintain my composure here. Sally French, you guys, fantastic. So, yes, thank you. Some of us signed a card. I couldn't get everybody on the card, so maybe at the end we can applaud her, and that's your way of signing the card. But she's been instrumental in the tire conference, 5-year tire plan, tire program for years. So let me go a little lighter so I can lighten up. But that's a rubber plant. You got. You guys all knew that, I'm sure. So. Even though a couple are retiring, I can't prevent that. There's a new condition on retirement, is that you have to produce one tire prior to retirement.
Okay. I will work on that this year.
So here's a card. And Sally, thank you.
Thank you.
We really appreciate you, and we're going to miss you when it comes to the next tire conference. And so with that, I'm going to turn it back over to you. But could you guys all give Sally a round of applause, please?
Thank you. Thank you. I didn't expect that. I wanted to remind everyone that November 30th, we'll be holding our next workshop to discuss our 5-year plan. This will be held in person at our Cali PA building, virtually, and we will have our Spanish translators again. Information on the conference or on the workshop will be on our public notice. About a week before that workshop, you'll be able to find our agenda and a draft plan that you could review. It'll be on our tire events page. And I really want you to get involved. This is staff putting together what we think a plan should look like. So we're going to unveil it, walk through it, and then we would like to hear some feedback. What do you like? What do you don't like? So we can go back, take into consideration what we've heard, and come back in the spring to a monthly meeting and have that plan adopted. So hopefully everyone will get involved in the process. Our next conference will be in the spring of 2024. So when you get your survey from Tommy, make sure you complete it. Let us know, what do you want to see at the next conference? Also, we'll be taking all of the presentations and we'll make those available to you. You'll be receiving another email from Tommy letting you know when those are available. I have some thank yous. I'd like to thank all of our speakers, our moderators, our exhibitors. We have our entire conference committee. Nate Goff from CalRecycle, stand up, Nate. We have Noelle from CalRecycle, Kathy Agregard, who is listening to us virtually. From the tire industry, we have Denise Kennedy from DK Enterprises, stand up. And we have Ed Boyson from Boyson Consulting, that is part of your planning committee. So give us your feedback. Sac State, I know Tommy's listening to us, if he could come in and wave to us, but Tommy Ombudsman has been the backbone of our conferences, helping us find facilities, caterers, putting together all of our slide decks, making your travel arrangements. He has been instrumental in all of the conferences that we've had. I'd like to also acknowledge Joaquin Marietta from CalRecycle's AV. He's our guru back there. We have Metro Media, that's been great the last couple of days. Translang is our Spanish translators that have helped us reach another group of stakeholders this time. Randy Russell, who's already left, he helped assist take virtual questions from us. And of course, Hannibal's, who provided the great food. If you could give them an applause. So in the spirit of recycling, when you leave, make sure to drop your badge in the box on the way out. And we will see you in spring of 2024. Thank you.